So without further ado, I'm going to ask Mary McKinnon to come down and share her patient story with you.
Hi, everyone. I introduced myself to some of you before we started, and I just wanted to say hi. I'm Mary, to anybody that I didn't get a chance to say hi to before. I'm a relatively new cancer patient. I was diagnosed last spring, so this is actually the first Kidney Cancer Canada event that I've attended, and I'm pretty happy to be here. So I'm a 50-year-old transplanted northerner. I've lived here in Ottawa for about the last 6 years. Until last summer, I was a pretty active woman. I was a labor lawyer. That's me in my office on the left. I was on the road about half the time. I worked pretty long days doing litigation. I have a son. That's him over on the left. He was 17 at the time I was diagnosed. And he was just finishing grade 12. And I had a pretty new relationship with a pretty wonderful man. I was a volunteer in various capacities. I had just started hosting a weekly radio program at a community radio station, and I was busy with my dogs and my family and all kinds of things. So like most of us, middle-aged parents, I was a busy person and thought I knew what my future had in store for me, and I didn't sleep all that much. In the middle of June last year, I noticed that I had small amounts of blood in my urine. I was prodded to go see my family doctor, and she sent me for an abdominal ultrasound. When she got the results the following week, she called me in, and she referred me very quickly to see a urologist. I didn't really understand what was going on. She didn't mention the word cancer, and all I knew was that the ultrasound said that there was a mass in one of my kidneys. When I saw the urologist on July the 7th, I went to see Dr. Caggianos over at the Civic, and he said that he thought that my mass was probably cancer. He talked to me about surgery. He booked me also for day surgery for a scan or a scope to find out whether or not my ureter was also involved. I had about a 9-centimeter mass, and he recommended, obviously, a full nephrectomy, and he also recommended that he wanted to go in and take a lot of the lymph nodes out and have a look at them and see whether there was local spreading. After I had the scope, for day surgery. The next day I had a CT contrast scan of my abdomen. The two things combined made something go kerflooey. I don't really understand. The doctors probably do. And I was in a lot of pain. My brother took me to emergency. I was passing a lot of blood and in a lot of pain. I ended up going back and forth to emergency a fair amount last summer. I couldn't really move around very much. I went from somebody who was at the gym or running pretty much every day of the week to being somebody who couldn't really walk more than about half a block without writhing in pain for several hours and then passing blood for several days. So you'll understand when I say that I was pretty delighted on August the 27th to have the full nephrectomy. I had 21 lymph nodes removed at the same time. My incision went all the way from my breastbone down to my pubic bone, and I was in the hospital for about a week afterwards, recovering. When I got home, I ended up back in emergency on another occasion because I had a lot of nausea and I really couldn't eat, and I was basically awake and pacing most of the time. So the doctors at emergency were very kind to me and helped me out with that as well. After that, I didn't have to go back to emergency for a while, even though, as my husband will tell you, I developed quite a friendly relationship with a number of the urologists. He didn't like how young and good-looking many of them were.
That's not true.
After my surgery, I went back to see Dr. Kajianos for follow-up in September, and he told us that none of the lymph nodes had showed any further evidence of disease. He suggested that I consider going into a clinical trial that Dr. Rayon was in charge of that was looking at whether or not pazopanib was helpful for people who had large local tumors but no evidence of other disease, and whether pazopanib could help prevent the spread of cancer. So I thought, well, I'll participate in that. I asked for that referral, and we went for ice cream to celebrate the good news. This is the cancer coaster, because after I was referred over to the oncology team, I didn't see Dr. Rayon, I saw his colleague, Dr. Cannell. They sent me for a number of tests that were necessary before I went into the clinical trial. I went in for an abdominal CT scan as well as a chest CT scan, and then when I went back to see Dr. Cannell at the beginning of November, she told me that there were some nodules in my lungs. She couldn't really say whether or not they were metastasized cancer, but she said, given my history, probably. So she wasn't sure whether I would be allowed to enter the clinical trial for pazopanib. Notwithstanding the nodules, though GlaxoSmithKline was nice enough to approve me for the trial, I took pazopanib from November until this March. I had many of the usual side effects. The side effect that caused me to go off pazopanib, that's one of those top of the roller coaster things, was my liver wasn't tolerating it, and I understand that that's fairly common. Even after a break, my liver immediately cringed and disagreed with the pazopanib, so I had to go off of it. For me, I got the news that my liver wasn't tolerating the pazopanib at the same time that I had CT scan results in March of 2013 that showed that the nodules had increased in number, had increased in size. Repeat CT scans in May also showed that the nodules were continuing to grow and continuing to expand in numbers. So I had definitely metastasized kidney cancer in my lungs, and the pazopanib hadn't shrunk or stabilized it at all. I just want to reflect here that all of this had and continues to be quite a roller coaster ride for me and for my family. When I found out in March that the disease had progressed and that I couldn't tolerate pazopanib, I was quite heartbroken. Since my surgery, I'd been doing pretty much anything I could think of to recover in order to go back to my old life, my work, my family, my social life, and my travel. I had started physio and Pilates at the beginning of October, about a month after surgery. I got my trainer to give me an abdominal muscle building program. I went to see my therapist to get me help to deal with this fairly huge curve that I'd been dealt with. I was seeing my chiropractor and going for massage to help work on getting me to sit up straight again. And I started to go to a naturopath when I was on pazopanib to help me deal with some of the side effects that I had with that. My then boyfriend and I also started going to couples therapy to help us work on some issues that came up and to make sure that we were on the same track. And I also joined Kidney Cancer Canada. Partly, I think I started out mainly looking for information, but I also ended up getting a lot of support, both on the forum and from another member. Linda here was nice enough to contact me when I joined up and said that, explained my situation and said that I was having some difficulty, and she was kind enough to spend a long time on the phone with me, talking about her situation and what my options might be, and just helping settle me down. In March of this year until May, my doctor referred me to a palliative rehab program here at Elizabeth Bruyere. I was a little bit spooked by the fact that it was called palliative, but it's a great program. They have a multidisciplinary team that helps with, they have a dietitian, they have occupational therapists, they have a physiotherapist who made me do exercises twice a week when I wasn't feeling like doing exercises anymore. They have a social worker who helped me find help for my son. He fell into an odd category because there's help for children who are dealing with their parents having cancer, but they have to be less than 18, and he was unfortunately 18. And he also really wasn't old enough to be considered a caregiver and to access help through some of those programs. So the social worker helped me there as well. After 2 months of giving my liver a break and reflecting on my mortality, I started taking Sutent, the standard first-line kidney cancer drug, at the at the end of June of this year. And I've also had the usual side effects from Sutent, but overall it seems to be treating me better than pazopanib. What is also helping me now is also the community and help I've found at the Cancer Foundation here in Ottawa at the Maplesoft Center. I've also been going there for exercise a couple of times a week. They have groups there that help you gain support for your situation. And I've also gone there for meditation class as well, which is a good stress relief. I've also had to change the way that I interact with my own community. I've always seen myself as a capable person and the person who helps others, and I've had to change the way that I look at that. I've had to start accepting help from friends, colleagues, and family members. Now that I've started to accept help from other people, it's not only helping me practically, figuring out how I can eat, figuring out things that are okay for me to still do. It's also changed my dynamics with people and allowed us to become closer. So currently, I think I've always been a pragmatic pessimist, but now I'm a pragmatic optimist. I'm optimistic about where I'm at. I was telling some of you that my most recent scans at the end of September showed a very good response to Sutent. It's gotten rid of some of my metastases, and it's shrunk considerably some of the others. So I can also say that I'm optimistic also because even in the face of the first drug not working, I took a leap of faith in myself and in my future, and I got married in July. I know that with an intermediate risk and with the limitations that Sutent has, I'm not looking at a cure, but at length and quality of survivorship. But with the help of very good physicians that we have here, very good health providers, agencies, and friends and family, I'm determined to get the most out of the most days that I can, and also the most out of each day. And my takeaways are basically to encourage you to find your own supports. There's a psychosocial program here at the hospital. There may be individuals out there who are willing to help you. Some of the agencies that help me might also be supportive for you. Don't be afraid to ask. If you're having difficulties in whatever area of your life you're having difficulties. I thought that I would be whiny, that I might be whiny to the oncologist team, but now I sort of look at myself as a research assistant So I report everything that's going on, and sometimes there's ways to fix it. You find what you need to make things manageable. I would never have decided to wear shoes like I'm wearing now previously. I had a good collection of high heels that I've gotten rid of to help me manage Sutent and the side effects of Sutent. And make the most out of each part of the journey. I recently read a book by Augustine Burroughs who was describing how to survive and how to be sick. And he said basically, anytime you have a phone call from your doctor that says that they want to share lab results, it's time to have some cheese. And every time that they need to see you in person to talk about your lab results, it's time to have some really good cheese. So that's what I leave you with. Have cheese and have the good cheese.
Wow, thank you, Mary. That was very inspiring, and I hope it started our evening certainly off with a very positive message and hopeful tone to it. So, and I can share the messages up on the screen already. Nicole says, congratulations, your courage is inspirational, and Deb is saying incredibly touching. Thank you, Mary. And I reiterate that. Your positivity and not being afraid of words like palliative and survivorship allow you to advocate for yourself and move forward on this journey with hope and positivity. So congratulations.